Good morning, ma'am. I am Maricel Diaz, student nurse of Davao Doctors College, and in this video, I will perform open gloving. It protects person involved in patient care activities that involve blood exposure or other bodily fluids during contact precautions or outbreak situations. Now, for the preparations, we have to remove jewelry and other accessories in arms and wrists. For instance, our watch, or if you do have rings in your fingers, you must remove it before performing the open gloving. For jewelry can harbor microorganisms. Make sure that there is no artificial nails, extenders, or cheap nail polish. So before performing the open gloving, check your own hands. So I have no artificial nails, no extenders, or cheap nail polish. So artificial nails, extenders, or cheap nail polish can harbor additional microorganisms. Inspect hands for sores and abrasions. Report to supervisor as required. So before performing, check your own hands. So my hands are clean. There are no noted any soreness or abrasions, so there's no need for me to report to my supervisor. Sores and abrasions are being checked because they can also harbor microorganisms. Short sleeves are at least 2 to 3 inches above the elbows. So my sleeves are at least 2 to 3 inches above my elbows, which is good. So this step prevents the sleeves from becoming moist and prevents the transfer of microorganisms from the sleeves. Now, let's move on to donning sterile gloves. First, perform thorough hand washing or hand hygiene or use alcohol-based hand wrap. This step decreases the bacterial count in hands and prevents contamination of sterile equipment. Cleanse surface to open sterile field and raise its height to waist level if necessary. So let's clean the surface of the table using wipes or tissue. First, then discard. Another one, then discard. Next one, and discard. This is to prevent cross-contamination and raise its height above or in the waist level if necessary. All sterile items must be kept above waist level. Now, inspect outer packaging of gloves for sterility. Now, let's check the outer packaging of the gloves if there is any tear or if it is wet or if it has damage. Also, don't forget to check the expiry date. So the gloves or the outer packaging of the gloves is still intact. It is not wet and it has no damage. So this is still considered sterile. All sterile items must be checked prior to use. Always examine sterile items of the glove for the intactness, the expiry date, and tears. So the outer packaging should always be kept dry, and sterile gloves have outer packaging that must be removed prior to use. Open sterile packaging by peeling the top seam and pulling down to expose second sterile wrapper. So now let's peel off the top seam. And place the inner package on working surface and expose to see the right and left gloves. And set aside the outer packaging on the corner of the table. So, open the second wrapper. Open cereal packaging without contaminating inner package. Start with the dominant hand first. Since my dominant hand is my right hand, so we will be doning first my right hand, using of course the thumb and index finger of my left hand. But before that, we have to open packaging and make sure to maintain sterility of the gloves. Open cereal packaging without contaminating the inner package. Pick up glove for dominant hand using the thumb and index finger of the non-dominant hand, which is my left hand, by grasping the inside of the cuff or the folded cuff edge of the right glove. So now let's use our thumb and index finger and position our right hand like this for easy insertion. And insert. Make sure not to touch the outside of the cuff or the outside of the glove. And pull glove completely over dominant hand, leaving cuff and being sure that it does not roll up wrist. And make sure that the thumb and fingers are in proper place. So adjust using the inside of the glove. This step allows for ease of application. Now, insert glove hand into the cuff of the remaining glove, which is the left glove. So, position your dominant hand like this, making sure that the thumb is away to avoid touching the other glove while inserting it into your non-dominant hand. So, insert your fingers into the cuff. Then, position your non-dominant hand into this for easy insertion. And insert your fingers. Then, pull remaining glove on non-dominant hand and insert fingers. Then, adjust gloves if necessary. This ensures proper placement or proper fit of the gloves. Once gloves are on, interlock gloved hands and keep at least 6 inches away from the clothing and keeping hands above waist level and below shoulders, like this. This step prevents the accidental touching of non-sterile objects or the front of the gown. Now, let's proceed to doofing the sterile gloves. First, remove the gloves by grasping the outside edge of one cuff or palm with gloved hands. Avoid touching the wrist. So let's do first the glove of non-dominant hand, which is my left hand, by grasping the palm like this. Then pull the glove off, turning glove inside out like this. Then doing this prevents the contamination of the hand after removing the glove. Now, place and hold the removed glove in your gloved hand like this. Then take ungloved hand, which is my non-dominant hand, and slide an ungloved finger or thumb. I will be using my index and middle finger and insert it under the cuff of the remaining glove like this. The inside, like that. Doing this prevents the contamination of the hand when removing glove. Now, peel the glove off inside out over previously removed glove, bagging both gloves. So, let's turn it inside out like this, bagging both of the gloves. Doing this prevents the contamination of the hand when removing the glove. Then, discard the gloves in the appropriate waste receptacle. And also discard the wrapper and the outer packaging of the sterile gloves. This prevents cross-contamination and deters the spread of microorganisms. And lastly, perform hand washing or hand hygiene after glove removal. This removes powder from the gloves, which can irritate the skin. It also prevents contamination from potential pinholes in the gloves. And that would be all. Thank you for watching.